Mheshimiwa, thank you for having a quick chat with me. So in regards to the report, you've seen that the report that the Kenya has made on the right to health has only bring out the structural issues that they have done in terms of, increasing health facilities. Do you think that is enough in terms of attaining the sexual reproductive health and rights for women in Kenya?
Let me start at the top and say that we have committed to the Abuja Declaration, which requires us to put 15%. 15% is 15%. If we're still at 6.5%, that is not good enough. We must make deliberate efforts, including the Parliament, at budgeting time. The reason that the parliamentarians don't understand why they must put the 15% is some of them are not sensitized. So there's a lot of sensitization that must happen amongst government officials, including members of parliament, but also CSO should do a more outreach effort to advocate and mobilize and lobby parliamentarians to understand why 15%, according to the Abuja Declaration, will make the big difference for Kenyans. So health is so important, it's a basis for every other development. That is number one. Number two, on sexual and reproductive health care, I totally am frustrated and disappointed that the government has withdrawn, the Ministry of Health has withdrawn the guidelines on safe abortion. We know that comprehensive sexual health and reproductive rights include the right to safe abortion for mothers who need it. So I think those guidelines were good and they should be reinstated, as well as other family planning methods, so that abortion is a very rare occurrence, and when it is rare, it is, and a woman chooses that is the last case situation she needs with her doctor, it will be safe and it will be legal, and that the doctors can provide a safe and legal environment. But most important is these other family planning methods and efforts that need to happen, including healthcare resources for teenagers. Young people are sexually active and got reproductive healthcare needs when they're young, and sexual activity starting from as young as the age of 10. So what we need is age-appropriate, comprehensive sexual education, age-appropriate. If you don't teach them, somebody else will teach them. They're learning from the internet. Last year, when you do the Google search, it says that the most searched terms on Google was how to procure an abortion. That has to tell you that Kenyans are searching about abortion more than they're searching about Arsenal, Manchester United, Gor Mahia, Raila, Uhuru, Ruto. Abortion is more important topic to Kenyans than all those other topics. So that tells you that we need to start educating our children on how to take care of themselves, to avoid early pregnancy, to delay sexual activities, to delay sexually transmitted diseases, the risk of infection. Those are the types of things that I think are important. And lastly, for myself as Member of Parliament for Kibera, you heard the government mentioned, for instance, some efforts to bring in water and sanitation. More toilets have been built through Ministry of Devolution and NYS. We're pushing Earthy Water to complete sewage lines to make sure that everywhere in Kibera, even within the slum, there's access to modern sewage lines. That is still not enough because the cost of water in Kibera is 20 times the cost of water in any other part of Nairobi. We still need to make sure that there's clean water that's accessible in Kibera, and the government has not done enough to bring clean water to the people in Kibera. It's one thing, and it's nice to build us toilets, but it's another thing to still let the poorest people in Nairobi pay the most for their water. Water in Kibera is more expensive than petrol. That should not be the standard. We need it, and the government needs to do more. On the issue of Nubian citizenship rights, the government was silent. Nubians are at risk of statelessness, and the government needs to make sure that Nubians who are being vetted against discrimination on issue of IDs, that must stop. We're not a border community. 99% of Nubians who are registering now for citizenship to get an ID were people who were born and raised in Kibera to parents who are Kenyan citizens. Let the government stop discriminating them. The Nubian population is only about 30,000 people in a country of 40 million. We can't be discussing this story for 10 years. Yeah. It is something we can sort down even in 3 weeks. Come and get in the village all the Nubian young people who are 18 and above who don't have IDs, give them the IDs, and you've done justice. So I don't see why the government lets things like that to last for too long. Yet there's small problems you can solve. Even with a 1 or 2 week campaign, you can tell the Nubian community, all young people, come and register for your IDs. We give them. It's a small problem we can solve quickly, but the government has failed in that. So I'm very upset with that. We still need to hear the government position on what steps will they take with the community land bill, with the National Land Commission, with the governor of Nairobi and the presidency, to make sure that a title deed is issued for the Nubian community and compensation for land that has been lost. The land that is remaining in Kibera that can be given to the Nubian communities is too small. We need more land for them allocated elsewhere, or another form of compensation for the land that they originally had, which has been taken and won't be given back to them. So those are my key issues, I would say. I think Kenya has steps to go ahead, and myself as a member of the government, I will do my part in Parliament to constantly make sure that this report that has been brought here is also brought to the Parliament in Nairobi at committees, and it is investigated, and parliamentarians are seized of it and understand it, and then we know what is our role. You know, we don't just ask questions, but we also have a role to make the laws and make the budgets to make sure that we are promoting human rights together.
Okay, thank you very much.